Hey friends.
Hello guys.
Yesterday we discussed some 5 marks. Of course, then today we shall continue the rest of the 5 marks.
Anyone the question?
Abductor of the hip joint.
The muscles that sit around the side of the hip are called the hip abductor muscles. The hip abductor muscles include the gluteus medius, gluteus minimus, and tensor fasciolatae (TFL). They not only move the leg away from the body, they also help rotate the leg at the hip joint.
Their main functions are to move your leg out away from the midline of your body, abduction,
and to anchor your pelvis to your.
The hip abductors are necessary for staying stable when walking or standing on one leg. The primary hip abductor muscles include the gluteus medius, gluteus minimus, and tensor fasciolatae.
The piriformis, sartorius, and superior fibers of the gluteus maximus are considered secondary hip abductors.
Due to their position, the hip adductors shape the surface anatomy of the medial thigh.
These muscles extend from the anteroinferior external surface of the bony pelvis to the shaft of femur and proximal tibia. The majority of hip adductors are innervated by the obturator nerve L2-L4
and supplied by blood mainly via the branches of the femoral and obturator arteries.
The main action of this group of muscles is to produce adduction of the thigh at the hip joint.
They contribute to the stabilization and balance of the pelvis and body posture while standing, walking, or running. Can we move on to the next question?
Yes, what is last question?
Popliteus muscle is the last question.
The popliteus is a small, thin, flat, triangular-shaped muscle of the lower leg. It is a deep muscle of the knee joint, forming the floor of the popliteus fossa.
It belongs to the deep posterior leg muscles, along with tibialis posterior, flexor digitorum longus and flexor hallucis longus.
It also makes up the lateral musculature of the knee joint, along with the iliotibial band.
The popliteus muscle extends over the posterior aspect of the knee joint. Can you explain its origin and insertion?
The muscle fibers originate from the lateral condyle of the femur by a strong tendon called popliteus tendon.
The popliteus tendon courses in the groove for popliteus muscle on the lateral aspect of the lateral femoral condyle.
This tendon is joined medially by tendinous fibers arising from the posterior horn of the lateral meniscus. The popliteofibular ligament connects the popliteus tendon to the medial aspect of the head of the fibula.
The popliteus tendon then expands into a triangular muscle belly that passes inferomedially over the posterior joint capsule of the knee joint.
The popliteus muscle inserts on the posterior surface of the proximal tibia.
Can you say its innervation and blood supply?
The popliteus muscle receives nervous supply from the tibial nerve L4S1, a branch of the sciatic nerve.
The popliteus receives arterial blood supply from the inferior medial and lateral genicular arteries, the posterior tibial recurrent artery, posterior tibial artery and the nutrient artery.
Guys, we completed the 5 marks question. Yes? Then see you all tomorrow. Bye.